Thank you for joining ElderHelp's Fall Prevention and Home Safety webinar. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp. So my role is to oversee and make sure that all of our community outreach efforts are reaching older adults to make sure they know about our services. I also work closely with our volunteer team, and I oversee our family caregiver support program. So this webinar topic is near and dear to my heart. Personally, I have witnessed family members who have experienced a fall. I've seen the causes and the results of that and how that changes one's life. I've also worked in a long-term care skilled nursing facility that had a lot of people coming in even for short term after having a fall and injuries and needing to recover. So I will be sharing a lot about fall prevention and home safety today. I'll start by giving you an overview about ElderHelp so that you can understand the services that we provide. And at the end, I will talk more specifically about the home safety and maintenance services that we offer geared around fall prevention. So you'll kind of hear a lot of different things, but hopefully you'll take away some good information, whether you're looking for yourself or for somebody else that you might be caring for or just planning ahead. So I'm glad that you're here. So if you're not familiar with ElderHelp's mission, our main goal is to help older adults continue living independently in their own homes for as long as possible. So we want to help them do that safely and successfully and to live with dignity. So that's really what we strive to do through ElderHelp. We are celebrating our 50th anniversary of supporting older adults and also family members who might be caring for a loved one. So we're really excited about that celebration, and we know that our work is not done, and as the population continues to increase, we hope to be around for another 50+ years. So we focus on a lot of different areas that we really aim to impact through our program. So I'm not going to spend a lot of time on these, but just so that you're aware that we really look at the whole person and how somebody is living in their home. We focus on overall health and mental health. We want to help to maintain nutrition, adequate nutrition, and help with the food insecurity issues that we see. We want to prevent hospitalizations and emergency room visits. We, of course, want to prevent falls. That's why we're here today and talking about fall prevention. So we do that a lot through our home safety services. We want to prevent homelessness and help individuals to maintain stable housing and to prevent social isolation and loneliness. So all of those different components are really important when we are caring for our clients and when we're communicating with people out in the community as well. So at ElderHelp, we have a set of core services. We have our information and referral service that's available to anybody who might be looking for resources. So you're welcome to call us or send an email through our website, and we're always happy to point you in the right direction for a community resource or a program through ElderHelp. We offer a few different check-in call programs. So Are You Okay is a really great option for people who might live alone and may not have anybody who's checking in on them on a regular basis. It just gives them peace of mind knowing that somebody's going to call on a consistent schedule. So if something isn't right, we're able to identify that and help them through it. We offer a variety of nutrition services through our grocery shopping support as well as a food pantry. We offer transportation through our Seniors A Go-Go volunteer driving program. We offer through care coordination. We have degreed social workers that assess our clients' needs in the home. So they're really looking at that full picture of how somebody can live safely and successfully in their home for as long as possible. And then they coordinate with our volunteers to help with a variety of services that can really make a huge difference. So the grocery shopping assistance, friendly visits, home office help, minor home repairs, and more. Our housing services team focuses a lot on stable housing and preventing homelessness. So we have a roommate matching program called Home Share, and we also support a couple of low-income senior buildings. And then our family caregiver support is where we host a lot of these webinar topics through. So if you're interested in seeing what other topics we've covered in the past, you're welcome to check out the library that we have on our website that lists all of the previously recorded topics, and you can just scroll through and pick topics that are relevant for your situation. We also have created online courses that are helpful for family caregivers to navigate that journey. So whether you're just starting out, whether you're just thinking about, the changes that might be coming, or you are providing day-to-day support for a loved one, those courses are really helpful. They're self-paced, so you can access them at any time when it's convenient for you. So I encourage you to check those out. And we are grateful to partner with a couple of other nonprofit organizations, Alzheimer's San Diego and Southern Caregiver Resource Center. So collectively, we're trying to support more family caregivers because that number is increasing as well. And that gets us to today's topic. So I am going to put on a different hat. So I am also part of the San Diego Fall Prevention Task Force, which is a group of people who get together through the County of San Diego Aging and Independent Services. And we focus a lot on how we can prevent falls in older adults in our community. And we do that all throughout the year. There's different programs that we put on, or different presentations we might do for groups who want to have that topic brought to their older adults. And this week is, in particular, we're wanting to make sure that we're spreading the message far and wide because it is National Fall Prevention Awareness Week. So while falls are an issue all year long, this is one week that's dedicated to making sure that we're getting that message out. So there's a lot of different activities that have been taking place. So the presentation and the educational topics that we'll talk about are all through the Fall Prevention Task Force. So let's first start by defining what a fall means. Sometimes people have different variations. They have different ways that they describe a fall. But the World Health Organization describes a fall as an event which results in a person coming to rest unintentionally on the ground or floor or other lower level. So those are the types of falls that we'll be talking about today, and I'll of course be sharing a lot of different ways that we can prevent those falls from taking place. And again, if you're looking at this information for yourself or for a loved one or a friend or just in general, I think that you'll find all the information is really relevant for anybody. So I'd like to start by debunking some of the common myths about falls that we hear all the time. So we do hear quite a bit, well, muscle and flexibility can't be regained. And that actually isn't true. What is true is that as we age, our muscles do lose some of their capacity. But through exercise, we are able to build up some of our flexibility and balance and muscle partially. So we're not able to bring it all the way back, but we are able to improve our muscle and flexibility by staying active and keeping our bodies moving. The second myth is if I limit my activity, I won't fall. And that isn't true as well, because if we are not using it, we're going to lose it. So that means that if we are going to stay in our environment, we're going to sit in our favorite chair, and we're not going to go out and do the things that we enjoy doing, our body is going to think that that's the new normal, and it's going to lose that flexibility and that stability. So when you maybe trip over something, you aren't going to be able to catch yourself as much because it's not used to doing those things. It's used to sitting and being more sedentary. So it's really important to increase that activity and keep that going. The third myth is if I stay home, I can avoid falling. I hear that all the time. Well, I'm just going to be more careful. I think I'll just stay home. I won't go and, visit with my friends or go to that group that I used to go to. And over half of all falls take place at home. So if you stay at home, that does not decrease your chance of having a fall. So we really want to make sure people are staying engaged, and having that social activity has a lot of benefits, not only physically, but also mentally. So we want to encourage that as much as possible. And the fourth one is falling is something normal that happens as you get older. So we are at a higher risk for falling as we age, and there's a lot of different factors that go into that, which we'll talk about today, but it is not a normal part of aging. So it's not normal. And the good news is that there are so many different things that we can do to prevent a fall from taking place in the first place at all. So we'll talk about that. But first, why is this important? Well, having falls is definitely something that is a serious concern for older adults because we are seeing that 1 in 4 older Americans fall each year. That's a lot of people, and I know that the population is growing. So it used to be 1 in 3 older Americans, and now it's 1 in 4. But that doesn't mean things have improved. It just means the population is bigger. And falls are the leading cause of injury and death among older adults. So I think that is really important to keep in mind, that if we can prevent those falls from taking place, then we're going to keep people safe and out of the hospital and up on their 2 feet, which is where we want them to be. And then fall risk does increase with age. And again, we'll talk about what that means and all of the different factors that go into it. So just that we can be aware of that. Again, it's not a normal part of aging, but our fall risk does increase with age. And then falls, if somebody has had a fall, that really doubles their chance of having another fall, which means that falls into the history and the risk factor. If you've had one fall, you are doubling your chance of having another fall. So it is important to kind of break that cycle and to not have that fall in the first place. And speaking of the cycle of falling, so if an older adult has a fall, chances are it was a traumatic experience for them. Maybe they didn't injure themselves, but just falling kind of caught their attention a little bit more. Or maybe they did have an injury that resulted in them going to the hospital. Maybe they had bruising, they were sore. So that fall itself is going to change somebody's way that they're living. And if they have that fall, then chances are they're going to fear having another one, which then causes them to be inactive and to stay more sedentary, which then, as we've talked about, decreases their muscle strength and their ability to have that balance. And that puts them at an increased risk of falling again, which starts the cycle all over. So you can see kind of how that can happen with individuals. And if any of you have fallen, or if you've known somebody who's had a fall, I've definitely seen this cycle play out, and it is very, very true from what my experience has been. So the Centers for Disease Control and Prevention have really wanted to get the message out about 4 steps that we can take to prevent falls. So these are the categories that we're going to talk about today. So speaking up, keep moving, checking your eyes, and making sure that your home is safe. So we'll talk about all of those different aspects as we go throughout. So we're going to initially kind of talk about the problem and what puts people at a higher risk, and then we're going to talk about the solution and what people can do to lower their risk. So we know that medical conditions and medications can put older adults at a higher risk for having a fall. If we think of certain medical conditions, like somebody who has a diagnosis of diabetes, they may be experiencing neuropathy, where they have numbness or the feeling of pins and needles in their lower extremities. And so they might not be as stable on their feet. They might not move the same way that they used to. So that does put them at a higher risk. Having, heart disease might cause somebody to feel more winded on a more regular basis. And so they're having to stop and take breaks, and they want to make sure that there's, a bench close by that they can do that. So kind of just looking at all of those different things that can have an impact. And if somebody is taking any medications that might be helping to treat their medical condition, but we know that medications also have side effects. So it could be that somebody has increased dizziness or drowsiness, when they're taking a medication. It could be that somebody might be taking antidepressants, or they might be taking sleeping pills, and all of those different medications interact with our bodies, and they have different side effects for everybody a little bit differently. So it's important to take a look at all of those so that we can make sure that we're doing what is needed for our body. So the solution for that is to make sure that we are staying on top of our visits with our physician. So it could be, every year you're going to go to your doctor or take your loved one to their doctor, and you're going to review all of the things that are going on. What's important is that you are sharing with the doctor about what changes you are experiencing. So if you're feeling like things are different, or I do feel dizzy sometimes, maybe it's not a side effect of a medication, it's just something new for you. That's important to let the doctor know about, because if you don't share those things, they're not going to know how to help you address that. It's also really helpful to make sure that we are having our medication list reviewed on a regular basis. So taking that into a doctor is a huge help. Not only prescription medications, but it should also include any over-the-counter medications or supplements. So even vitamins interact with our body and also interact with other medications. So it's important to take a look at all of those and have them reviewed on a regular basis. If you have multiple doctors, or maybe your loved one does, they have all the specialists that are prescribing different medications, you can always take a list to the pharmacist, and a pharmacist would be able to go through them, and they could identify maybe there's 2 medications that are doing the same exact thing and 2 different doctors prescribe them. So having somebody review all of those medications at once is really important so that they can give their recommendations. They can also reach out to the doctor and say, hey, just want to make sure that this person should continue taking these as prescribed. So that's really important so that you can make sure that you are staying on track with that, but communicating with your doctor about changes that you are noticing, because changes happen. Every year there's probably something a little bit new. We know that your time with your healthcare provider is somewhat limited. They have a schedule and they need to keep to that. So it's important that we're coming in with our plan and with our questions so that we're staying on track and able to have all of our questions answered. So some questions in particular that are helpful to focus on that fall prevention side is asking your doctor, how can my health affect my risk of falling? Maybe there is a new medical condition that you've been diagnosed with, and you're wanting to know, how is that going to change how I'm living, and what do I need to do to modify that so that I can be safer? The next one is, can my medications contribute to a fall? So again, finding out what those side effects are so that you can be aware and you can make changes accordingly. Should you be taking nutritional supplements? Those should all be conversations that you have with a healthcare provider. So it's important to have that conversation and figure out what's best for you. And in terms of physical activity, everybody is a little bit different. And so the same exercise program might not be the best for each person. So talking to your healthcare provider about what is recommended for your situation is going to be the best. Even if you come with a few options and say, I'm considering doing Tai Chi, or I'm considering doing yoga, or do you think I should do more brisk walking? Any of those things are going to be helpful just to have that conversation so that they can say, oh, but this might interact with that, or I'm not sure that this would be great, or things to keep in mind if you are exercising. So all of those are really helpful, but come in with your plan so that you can make the best use of your visit with your healthcare provider. So I know we're not in a room together, so we'll just kind of have you do a quick self-assessment of yourself. And if you wanted to respond in the questions or chat, you're welcome to do so. But just kind of looking at, think, have you fallen in the past year? If you might be saying yes or raising your hand. Do you feel unsteady when you're standing or walking? So do you feel like your balance is changing? Do you feel like you are paying more attention to that? And do you worry about falling? If you answered yes to any of these questions, that means that you could be at an increased risk. So it's important to, again, talk to your healthcare provider and figure out what some of those things are that you may be able to do to prevent yourself from having that fall. So the next problem that we'll talk about is having that inactivity and the fear of falling. And these are valid. There are people who have a fall and they are so fearful of having another one that they choose not to go out and they choose to not do things, and they're even walking differently. So you can see a couple of pictures on this slide. So I'll explain what those are. So if somebody, were to walk on a strip of tape going down a room in the middle of the room and it's on the floor, you're going to walk through, you're going to be more confident, you're probably going to be swinging your arms, you're going to be staring straight ahead to see where it is that you're heading to, kind of your point A to point B. But if you were to have that same strip of rope or of tape, and that is now put 10 feet above a really bubbly brook that has alligators chomping at you from the bottom, you're probably going to have that fear factor. Your body is going to feel that all over. So you are going to tense your muscles. You're not going to take those big steps anymore. You're probably going to take very small steps. You're going to be more rigid, often looking down. And so that fear has an impact on your whole body. And so that's just one example of kind of how to show that. If you're more confident and you're walking and you don't have that fear, you're going to be doing it at a more normal pace. But if that fear is impacting you, it's definitely going to cause your body to walk differently and to change how it's moving. So just something to keep in mind with that. In terms of inactivity, having a sedentary life, maybe that's been your normal for your whole life, but you're feeling like, okay, it's time for me to do a little bit more. It's never too late to start exercising and to start moving. So rest assured, you can pick something up and find what works for you. But having that inactivity is definitely something that we look at, and during the pandemic, and we're still seeing the effects of the pandemic for older adults, and having that inactivity and staying at home did impact a lot of them, and we're still seeing that, and we'll probably continue to see the effects of that for several years to come. So the solution is to keep moving. So to make sure we are doing whatever it is that we enjoy that keeps our bodies going. So again, that looks differently for everybody. It could be Tai Chi or yoga. It could be walking. It could be gardening or doing something outside. It could be doing simple exercises like the picture here, the sit to stand exercise. We have to sit up and stand up multiple times a day, getting up from a chair, getting up from a car, getting up from the toilet. There's all different times that we are using that mechanism. So even just having repetitive movements of standing from a chair, not with wheels on it, make sure that it is a stable chair, but that could really help to improve balance. And we'll talk a little bit in a few minutes about some of the exercise programs that are available through the County of San Diego. They have them virtually. There's also a lot in person, and they're spread throughout. So there are different ways that you can join groups or do things on your own as well. I'm going to go back just for a second because I wanted to mention, like some people ask, how long should you be exercising for? And the recommendation is that about 150 minutes every week that you are doing some type of moderate, intense activity. So that's 150 minutes each week. 2 days of that should be focused more on the muscle and balance and flexibility. So just kind of keeping that in mind, so that if you are looking at, okay, what should I do? Trying to keep yourself moving and fit something into your daily routine. If it's not something that you've done a lot, going to the mailbox or going around the block, just different things like that can really make a difference. Okay, now we'll get into footwear. So there are on this side, and you can see how they're different. We have the heel, we have a shoe that has a very thick sole, and then we have flip-flops, and we have low-soled loafers. So next I'm going to show you which 3 are not recommended as being the safest when preventing falls, and then which is recommended. If we're in a room, it would be a little bit different. I'd have you point to them, but so obviously we know heels, you know, they're a little bit more difficult for people to walk in. Your ankles often can roll if you're not careful, and especially on uneven ground. So that's something to keep in mind. Sometimes people think that having really thick soles on shoes is a good thing because you're more stable if it's that thick, but it actually doesn't allow your foot to be more centered on the ground. So you really don't want to have too thick of a sole there. And then flip-flops, we know our feet can kind of slide out. It doesn't hold our heel in. So it's not one that is recommended when we're looking at that fall prevention and that safety. So the loafer on the other side is the most recommended shoe to wear. It holds the heel in place, and it is a thin enough sole where you can feel the ground underneath you. All right, so moving into vision. So having poor vision can definitely increase your risk of having a fall. And we know that as we age, so people between the years of 40 and 65 start to have pretty significant changes with their eyesight. So it is important that we are taking a look at that and making sure that we're addressing what needs to happen. For some people, they may have always you know, had different vision situations. Maybe they've worn glasses their whole life, but it's really important to remember to have those checked on a regular basis so that you can have different prescriptions if needed. By the year that somebody is age 65, they're more likely to, there's about 1 in 2 that will have a pretty significant vision impairment. So it is important. There's a lot around lighting also, so making sure that we're increasing our lighting in our homes. And I know that I've noticed that for myself as well. You know, when I'm cooking or I'm reading or I'm doing different things, I'm needing more lighting. And so our bodies are telling us that is changing. And it's really important. We'll talk about the home side of it. But if you get up in the middle of the night, to make sure that you have a lighted pathway to get to the bathroom if you're going there, or to the kitchen. So making sure that we're kind of looking at those different things for vision. Also hearing, making sure that we're checking our hearing, and these are great to have both checked on an annual basis, just so that we can identify if there are changes. So the solution is to check your eyes. So making sure we're going to the doctor and having that annual checkup, just to again make sure that we have the best prescription and that we can see all the things around us that we need to. And if it's starting to change, then they can help figure out how to make it safer for you to continue doing the things that you enjoy. So then we get to the home side and the problem with environmental hazards. So if we were in a room, I would ask you to point out some things here in this picture, but I'll just point them out since we are in the webinar. So if you're looking, I always go straight to the stairs. That's where my eyes go, and looking at that. So this person is wearing slippers. She is walking downstairs that does not seem to have a railing on the side, on either side. Is she carrying anything? I'm not sure. But as she gets lower towards the floor, there's books that are in her way. So she's going to have to go around those books. So if she is carrying laundry coming down the steps, that's going to impede her vision and not be able to see what is coming up ahead. At the very bottom of the steps, we have a loose rug that she could very easily step on and have that slide out from under her. So that situation alone is definitely one that would be concerning. And then looking in the rest of the room, there's another rug that has loose ties coming up, and it's not secured down. There's cords going across the floor in a couple of different places. There's a cat that might be playing with the cords as well. And animals move at their own pace and differently, so that can be a tripping hazard as well. So there's a lot of different things that are going on. It looks like the smoke detector is out of batteries. And so the coffee pot looks like it's overflowing. So there's a lot of different things going on, not to mention the medicine cabinet is open. So there's definitely a lot with environment that we can do to make sure that we are living in a safe home and a safe environment to prevent ourselves from having that fall. So those are some of the fall hazards that we might see. So the solution is definitely to make your home safer, and there's a lot of different home safety checklists that you can find online. There are great programs that exist that would be able to help you do a home safety assessment. ElderHelp is one of those, and I'll talk about our services a little bit later on. But looking at all of those different tripping hazards and finding out what we can do to make those homes and that environment safer, and kind of going from room to room. What rooms are you staying in, or you need to go from the living room to the kitchen to the bathroom to the bedroom, making sure that all of the pathways are cleared from clutter, and that we don't have cords going across and we don't have those tripping hazards. So there are easy things that we can do to make it safer, even using double-sided kind of that sticky tape that can go down on the corners of the rugs, removing the rugs entirely, making sure that there are railings in place for people who have steps. And if they need one on both sides instead of just one, that can be modified as well. So, and then of course, lighting. So kind of looking at all of those different things. There's a lot around the home. Sometimes it's important to also look at getting out of the home and going down the steps or going down the driveway to the car, or if somebody's picking them up. It's really helpful to kind of look at all of those things. So not just inside the home, but what is their routine going out of the home? Because it could be that, in home, you've done everything that needs to happen, and the rooms look great, but as you step out the front door, there's a wobbly railing, there's a loose step, there might be a package that's left on the front porch. So just being mindful that that's just as important, so that we can encourage people to get out and about and do those things that they want to do, and make sure that it's safe. I also hear of people being out gardening on their own and maybe tripping over something in that environment as well. So making sure that you have either a life alert or a phone handy, so that if something does happen, you're able to reach out. So these are some ideas for tools that can help you. There are so many different tools that are available, but these are just a few ideas. So there's a reacher, and that is really helpful. I've even seen ones that fold up and can be put away more compactly, or there's ones that just stay put out. And those are really helpful for people who might not be able to bend down and come back up as easily. Maybe they have a change in their blood pressure when they do that. And so just keeping in mind, what can be a good use for them. Maybe having a reacher to pick up something that they dropped from their chair, or in between two things, or maybe they're picking something up off of the top shelf with that. It just depends, but having that as a tool could be really helpful. The bathroom is an area that a lot of falls can happen. So we always focus on the bathroom and making sure that there's different things that can make it a safer experience, so that people can bathe safely. So it could be, making sure that we have the non-skid strips in the bathtub. So when somebody's in the bathtub or the shower, that they're not going to slip in there. If somebody does feel that they are better sitting down, there are shower chairs that are available that you can put in the shower, and then use a handheld shower head so that you can easily wash that way. So that's another idea. And then getting in and out of the shower or in and out of the bath, that's something that's really important to make sure that we have the appropriate fixtures to be able to hold on to. There are a lot of different options, but we don't recommend that you use the suction cup grab bars because over time those can get water or soap behind them, and then when you go to grab onto it, it's gonna fall down with you. So we don't recommend using that. And also keep in mind that towel racks are meant to hold the weight of a towel, not meant to hold our body weight. So if we're using that as the mechanism to get in and out of a shower or in and out of a bath, that could potentially come out of the wall as well. So having a safety bar installed is really ideal. There's a lot of different kinds of those. There could be a fancier one that looks like a towel rack, but is still that bolted in a little bit stronger and is that safety bar. So having those in the shower or outside of the shower makes it a little bit easier for people to navigate that. And then there are different types of assisted devices like walkers or canes. And before you go and purchase one, it would be recommended to have a assessment by a physical therapist just so that you can have the right one and that they can give you recommendations for your situation and also adjust the height and make sure that it's going to be the safest option for you. So there's, of course, this walker on the screen here is the fancier one. It has the 4 wheels and it does have brakes, but that might not be the best option for people who might need a slower option, as those can go pretty quickly. Even if there's, not any downhill involved, they can move at a faster pace. So just having that assessment by a physical therapist can be a huge help just to make sure that individuals are using the safest assisted device that they can. Life alerts, so we see that. I talked about that a little bit already, but that's really helpful for people, especially if they live alone, just making sure that you have a way to reach out if you need that help. And don't tuck it in a drawer somewhere. I hear that quite often. Oh, I didn't bring that out today, or it's in my dresser drawer. But if you're not falling next to your dresser drawer, then it's not going to be useful when you do need that help. So wearing it around your neck or around a wrist. There's so many different types that are available now, and they don't typically call 911 as the first contact. So some people are worried about that. Usually it will be whoever they've listed as an emergency contact would be the ones to get the first call, and then they'll go down the line. So of course, if somebody does need more immediate attention, then they would be able to help with that as well. But those are really good options. All right, so we've kind of gone through a lot of different information here. Just to summarize the 4 steps that you can take to prevent falls. So speak up, make sure that we are talking to our doctors about different things and that are changing. And if you've had a fall, it's important that you do let your doctor know. It really is important so that they can address the situation that's going on and make sure that they're giving their recommendations. And we know that about 1 in 4 older adults is falling each year, and less than half of them are being reported. So it's really important that we are letting our physicians know, but also asking questions and making sure that we're looking at the medications that your loved one takes or that you take, and finding out if there are any risk factors that have increased because of those side effects. So all of those different things will be helpful. And then keep moving. Find that activity. Not everybody likes the same thing, but there are so many different ways that we can keep ourselves moving. And even if it's chair yoga, where you stay in a seated position and do different movements, there are different things that can be helpful and beneficial for strengthening your muscles and flexibility. Check your eyes, so making sure that we have our eyes checked and our hearing checked on an annual basis is really important. And then, of course, making our home safer. So looking at all of those environmental hazards and removing them as much as possible, and making modifications that can be helpful. It could be even just looking at in the kitchen, what are those things that you use the most, and moving them to a lower level. So you don't need to get that step stool to climb up and reach the thing on the top shelf that you use every week. So just modifying all of those different pieces can make a difference. So I'm going to go through some of the resources that we have available. So I mentioned that I'm part of the San Diego Fall Prevention Task Force. So our task force, again, works all year long looking at how we can get the message out there to individuals. And this week there's been quite a bit of activities. But if you have any interest in learning more about the task force itself or some of the resources that we have put together, you can visit sandiegofallprevention.org and be able to get all of that information. So I encourage you to check that out. I will send a follow-up that includes some of these links as well, so you don't need to jot them down if it goes too quickly. There are a variety of community programs that are available through Aging and Independent Services through the County of San Diego. So going to the healthierlivingsd.org website will give you a chance to see all of the different options that are available. There are many classes that take place all throughout San Diego County. So if you're not sure if one's in your area, going to that website would be a great place to start. There are a variety of evidence-based fall prevention programs. So there's Tai Chi for health, there's Tai Chi moving for better balance, there's bingo size, there's a matter of balance. So there's a lot of different programs that do exist that are available to help maintain that balance and to increase that ability to have that stability. So other health and wellness programs, there's the Feeling Fit Club that has different locations throughout San Diego County, and they typically meet at a center where multiple older adults might be able to get to it easily. So checking out the different list of Feeling Fit clubs around San Diego County would be a great start to just see what's available and see what's convenient for you. And everybody pretty much goes on a regular basis, but I think you can also jump in and join in when you're available as well. There are a few different healthier living classes that I think are really helpful just to know about. There's chronic disease self-management, there's diabetes self-management, and then chronic pain. And those are all peer-led programs. They're about 6 weeks long, and you are going to be able to work with other people who are wanting to make changes in their life for a similar reason. And so it's helpful to bounce ideas off of each other, to also encourage each other through that process. So you have the opportunity to create goals and then follow up the following week. But if you put something into effect within that 6-week time period, chances are you're going to be better equipped to continue with that moving forward. So those are really great programs to check out as well. There are also state and national resources. So again, I encourage anybody to check out the Fall Prevention website, and it will lead you to other resources as well. But these are through the National Council on Aging. And the Vial of Life. This is a really important resource to know about. If you haven't seen one before, it is a plastic sleeve that has a magnet on it that goes onto your refrigerator. And inside, there is a piece of paper that you would complete with all of your information or your loved one's information if you're looking for somebody else. And that would include your medications, any medical conditions that you might have, your physician's details, any allergies. All of that information is really important. goes in that plastic sleeve on your refrigerator or on your loved ones, so that if 911 were coming, if there was a paramedic that needed to figure out how to help you and you weren't able to communicate that with them, their first point is going to go to the refrigerator to see if you have a vial of life. And that is what they're going to be able to use to provide you with the best care at that time. So it is important to keep it up to date. So if your loved one does have a vial of life and it's outdated, take the time to go through that and update the information so that it can be as relevant as possible in the case of an emergency. You can order those through the County of San Diego, so I'll be sure to include that information in my follow-up email as well. And that was a lot of information, but that concludes the Fall Prevention Task Force presentation on how to prevent falls. So we talked about, the risk factors, but also a lot of solutions. So hopefully there were things that you were able to take away for yourself or for your loved one that you will be able to put into action and make changes so that you can stay as safe as possible. And I did want to talk about ElderHelp's fall prevention and our home safety and maintenance services. So we have wonderful volunteers who are available to help make seniors' homes safer. For this service, it can either be existing clients of ElderHelp's that are looking for this service, or it can be a community member that doesn't need any of our other programs, but is looking for a one-time project to be done. So keep that in mind if there's something that you're wanting some help with. We can do a home safety assessment. That's a checklist that we go through throughout your home and the different rooms to see if we have recommendations on how to make your home safer. So it might be the tripping hazards. It might be if we see loose cords going across the floor. It could be, wobbly railings, or maybe you need a railing. There's a lot of different things that we could identify by doing that home safety assessment to determine how to keep our loved ones and ourselves as safe as possible in our homes for as long as possible. And then after that assessment, we can help with those projects. So we help with minor home repairs. So it could be replacing smoke detectors or changing light bulbs. It could be that we're fixing that wobbly railing, or putting a strip of paint at the bottom of a step so that you know that that's the last step before you get to the landing. It could be installing safety bars or grab bars. So those are really helpful services that are available throughout Central San Diego, parts of East County, and North County. So I encourage anybody who might need that type of support or might be interested to give us a call and start that process. And I will leave it on this screen for a couple of minutes. That has our information if you're interested in reaching out to ElderHelp. Our phone number is 619-284-9281. If you want to send an email, it's info@elderhelpofsandiego.org. Feel free to check out our website, elderhelpofsandiego.org. Again, you can see the previously recorded webinar topics that we've covered. That would all be on the Employed Family Caregiver page. So check that out, as well as the other services that we provide. If you have any specific questions, I didn't see any come through, but you're welcome to type them in, and I'd be happy to help answer those for you. You also see my contact information on the screen, and we are so grateful that you joined today to be able to learn more about how we can prevent falls, whether it's again for yourself or for your loved one. Hopefully you're taking away some tips that are useful. And if you know somebody that could benefit from that information, hopefully you're sharing that with them. But I appreciate your time today, and I will stick around for a couple of minutes to see if anybody has any questions. So thank you so much for joining.